today for our weekly Wednesday press conference. I'm Representative Napoleon Bracy, Jr., representing Mobile County, and I have the honor to represent the great people of Alabama House District 98. Today, as we continue to recover from the economic impact of the pandemic, there's no doubt that we have made tremendous progress in Alabama, as our unemployment rate has fallen to a 2.3%. And in fact, many employers are now struggling to find workers to fill thousands of open positions. This is particularly true when it comes to employing qualified teachers and medical professionals throughout Alabama, especially in our rural areas. I mention this because although we have seen a robust economic growth in our state, there are still many areas that need our immediate attention. Too often people hear that the economy is doing great, but in reality, they are still struggling to make ends meet. Well, just because things may be great for bankers and investors on Wall Street doesn't mean things are great for the hard-working men and women who live on Main Street. This is why the Alabama House Democratic Caucus legislative agenda, the Plan for Prosperity, has had such a strong focus on economic growth to ensure that hard-working Alabamians have more money in their pockets. As part of that plan, I sponsored HB 154, which gave state employees a 2% cost of living increase, and I'm happy to say that that bill has passed the House by unanimous vote and is now being considered in the Senate. This is one significant way that we could transform from a trickle-down economy that simply factors the wealthiest versus a fair, equitable economy that grows from the bottom up and the middle out. This is also why my colleague, House Minority Leader Anthony Daniels, has sponsored HB 217, which will remove the state tax on overtime. Yesterday, this historic bill passed the House unanimously and is truly the first of its kind in the nation. This is a way we can reward hardworking men and women and also help employers keep motivated employees that are willing to go the extra mile. We believe that measures like these are critical because this is how we can help Alabama families thrive and prosper, particularly as we deal with lingering economic uncertainty due to rising consumer costs and inflation. I would now like to introduce Representative Patrice McClammy of House District 76, who will discuss more pro-growth legislation that focuses on helping Alabama families thrive and prosper. Representative McClammy.
Thank you, Representative Bracy. I certainly agree that it's our responsibility as legislators to help create an economic environment that is built on fairness and that fosters long-term economic growth. Like my colleague said, it's time for us to focus on Main Street. In Main Street, Alabama, to do everything we can help hardworking Alabamians and their families. For many years, the Alabama House Democrats have introduced legislation to end the state's grocery tax, and we are encouraged that this important kitchen table issue is finally getting the bipartisan support it deserves. Although we may have some differences in opinion on the details, it was heartening to learn that eliminating the grocery tax has received unanimous support in the Alabama State Senate and the strong support of our Lieutenant Governor. Hopefully, this will result in finally ending Alabama's regressive tax on food and will go a long way towards eradicating the food insecurity that's plagued struggling families and their children throughout the state of Alabama. The current 4% state food tax is equal to roughly 2 weeks worth of groceries on a typical Alabama family. In addition, Alabama is the 5th poorest state in the nation, with 17% of adults and 23% of children, 1 out of 4 facing food insecurity or lack of regular access to enough nutritious foods for an active, healthy life. Simply put, the grocery tax is the biggest obstacle as we face in reaching our goal of creating long-term prosperity for our families and our children in our state of Alabama. This is why it's so important that we come together on this issue, that we join the rest of the nation in eliminating this unfair tax that made it difficult for so many families to flourish and prosper. I would like to now introduce Representative Neil Rafferty of House District 54, who will discuss legislation that he has sponsored to help address the shortage of rural doctors in our state. Representative Rafferty.
Thank you, Representative McClammy. As we discussed previously, Alabama is facing an unprecedented crisis in finding doctors and other mid-level healthcare professionals to serve in the rural areas of our state. To put this into perspective, approximately 37% of Alabama residents live in rural areas, but only 24% of primary care physicians and 15% of physician assistants practice in these areas. This, along with our state's refusal to expand Medicaid, has been a major contributing factor in the alarming rate of rural hospitals permanently closing their doors. Sadly, there are too many areas in our state that have no immediate access to health care whatsoever. Although we have increased funding to expand access to telemedicine, there remains a troubling shortage of medical providers and healthcare facilities in rural Alabama. This is why we must take immediate action to recruit and retain more medical professionals to our state, and keep the ones that we're training here in the state, especially in our underserved and rural communities. This is why I sponsored HB 133, which would establish the Preceptor Tax Incentive Program to provide the opportunity for students enrolled in certain health professional training programs to train in rural and underserved communities and counties to address primary care shortages throughout the state. I'm happy to announce that the important piece of legislation has passed the House and is now being considered by our colleagues up in the Senate. For those not familiar with medical jargon, a preceptorship is the medical profession. In the medical profession is similar to an internship or a fellowship, but it's designed to integrate newly registered professionals into their new team and place of work. Preceptorships are a traditional part of medical practice, and they are designed to help new professionals translate what they've learned in the classroom into practical, real-life, on-the-job skills to serve these communities. By offering new medical professionals these types of meaningful incentives to practice in these rural areas that may not have otherwise had considered, there's an invaluable and innovative recruitment tool that now could exist. This is how we can recruit the best medical personnel and keep new talent and jobs in Alabama, especially in the areas that we need it most. By passing this bill, we will be able to attract and retain healthcare providers to Alabama and hopefully find a lasting cure for our medical staffing problems. This bill represents a win for healthcare providers, but more importantly, an even bigger win for small town Alabama families and those living in underserved communities. I'm proud to join my colleagues in the Alabama House Democratic Caucus in supporting legislations and policies like these that create jobs, generate opportunities, and yield prosperity. This is how we plan for a brighter economic future for Alabama and how we begin to implement our plan for prosperity. Thank you, and we'll be happy to take any questions at this time.
I have a quick question. This is in regards to the rural hospital closures. It seems like we keep hearing that there's going to be more and more hospitals closing. How will this affect a bill like yours, like that preceptorship bill? Are there any other plans as these hospitals close to put medical facilities or emergency rooms in those rural areas?
So this will help provide the opportunities for those students that have already completed their degrees and are studying for this and then put them in that area. So this definitely addresses the workforce issue, but what we really need to do to help maintain our rural hospitals that are closing is expand Medicaid. We know how much money that's going to bring down. This has already been established, and this has been said over and over and over again. In different iterations, how this would be a huge economic stimulus for the entire state and would definitely contribute to the plan for prosperity for all Alabama families.
So I had a question also about the grocery tax. It seems like this is a bill that's come up year after year. This year there's a lot of bipartisan support for it. What is different about the current proposal than what we've heard before? I guess I'm a little confused by it. There's been a lot of talk from some folks. They want to see it, go away all at once, but now they're talking about it. Again, where are they at right now with with bringing it down incrementally?
Well, the bill that the Senate has introduced by Senator Andrew Jones, that bill incrementally brings it down by 0.5 cent over the next 4 years. They have a proposal for a 2-cent release. Now, I am bringing up a resolution to go with those bills. In our resolution, we will have a task force committee formed in which they would be mandated to work and study quarterly how the money is generating and flowing from the ETL funds and everything, that we would evaluate. So if there is a possibility to increase more than 0.5 cent each year, that task force could bring forth that recommendation depending on how the level of the funds are going.
Okay.
And what is the difference? I think we've traveled over 20-30 years, beginning with Representative John Knight, and there have been many versions of this bill, and I'm sure that this is one that he's proposed in the past that's incrementally reducing. All I can say is thank God that we now have the bipartisan support that we need so that we can see some type of relief for our citizens.
I had a question, one last question for Representative Bracy, and that deals last year. I know that we had, or the legislature had passed a cost of living increase for state employees as well as teachers. I know this one deals particularly with the state employees. Is there going to be a similar bill, or is there similar plans to also increase teacher salaries again this year?
I think it is. You'll notice that you're starting to see salary scales kind of going around. People are looking at salary scales for teachers as well as the paraprofessionals or the ESPs, and also with the school nurses. So it's definitely a topic that's been a hot topic of discussion. I think we're very fortunate to be able to get this legislation passed because, of course, I serve on the general fund, and we're able to do this for our state employees. We know we can't keep up with inflation, but this will show them that we care about them and that we do want to do something to protect them as well by giving them this increase. And I think we need to be as consistent as possible and do this as often as possible for our state employees. Had the opportunity yesterday to also talk with some retired state employees, and they're hurting as well. So I think we need to look at a possible COLA for them or an extra check for them, and that's been a topic of conversation. And just to go back to HB 217 that passed yesterday, Leader Daniels sponsored bill to remove the tax from overtime. That is such a big deal for our workers, because right now with us having record low unemployment at 2.3%, the workers are just not there. But this gives an incentive for people that's already trained to do these jobs to just do a little bit extra, go the extra mile, and they are able to receive this benefit by keeping that 5% and being able to take that home while they're making either time and a half or double time doing this overtime. But it's also a major incentive for the corporations because they're able to meet demand, meet schedule, because they have qualified, trained workers that's already doing the job, just working a little bit extra. Company in Mobile was really excited about this bill because they have a 4-10 schedule where their employees work 4 10-hour days Monday through Thursday, and this is a major incentive for employees to come in and work on Fridays and still have the opportunity to have their weekends off. And production is just going to really go through the roof, and employees are going to be able to see this benefit back at home. Also, hospitals are excited about it in nursing homes because the CNAs, the medical assistants, the nurses, the LPNs, RNs. A lot of these people are hourly workers, and it's difficult to get people to work extra hours, and this will give them an incentive as well to have good quality trained workers in our hospitals and nursing homes.
Can any of you speak to I know that there's also another bill dealing with child care provider tax incentives. Can any of you speak to that bill? I believe Representative Daniels is the one carrying that.
I think some industries will really benefit from this because you will receive a child tax credit for being able to provide this type of service on site. We think child care is really, really important, and people are able to go to work. If their child is sick, you know, it kind of helps them to be able to bridge that gap and make sure that their kid can get quality care while they're also working. So, you know, of course, child care, transportation, all of these are very, very important factors when it comes to employment. But I think this is a bill that a lot of industry will eventually get on board and support. Thank you all so much for coming out.